Yes, thank you so much, Dr. Khalil. I have a question which I really actually want to know, Terry's perspective, but also Dr. Khalil and Dr. Luo's perspective, because it's a really good question. The question is about the best advice you have for newly diagnosed patients and what should their first steps be?
Do you want me to go for it first?
Yes, please.
Okay, because usually that's where it starts is like, okay, in fact, at one point we put out a poll, what day of the week were you diagnosed? Because and I was pretty convinced it was going to be the latter part of the week, and it was. We had a considerable amount of people were diagnosed on a Friday, which means now I know I have lung cancer. What am I going to do? And that leaves me all weekend to think. And although Dr. Google is one of the most dangerous places that you can go, you do need to connect out with the other patients that are going through it, because that's where you're going to find that amazing 4-letter word, hope. You're going to hear from other people that have walked the walk and know what the walk. But the best information I have is the thing that is the absolute hardest things to do. And that's you need to take the 2-week wait to find out what your biomarkers are to get the best treatment that you can possibly do. And in that 2 weeks, it is the most hellacious type of limbo for a patient, but that is also the biggest gift of time that you have. That's when you can reach out, you can wait, get that information, get that second opinion, start getting the things together that you need to feel that's going to give you a sense of control over what that looks like in your life, whatever that looks like, and really reach out to the other people that you need to hear it from, which I really think is the sense of community and that sense of hope, because we're not out here to scare you, we're out here to tell you what's really going on.
Okay, I'm gonna go next if that's okay. Thank you, Terry, so much. I think it's very, very important to, during that period that we call the limbo period, while you're waiting for more information about your cancer, the stage, the drivers, all those other things. This is one of the hardest things that people have to go through. And I think I would just say, find your rock, whatever it is, whoever it is. Whatever you enjoy to do in order to try to process and not just get your mind off of the diagnosis, but just process what you've been told. Find a person who you like to talk to, find a community that might give you just some information about what you're going through and what to expect. And find something that you like to do in order to stay as active as possible during that period of time and as present as possible in trying to process that information. I find that some of my patients just pick up either walking out in nature or some other form of way to help them through that waiting period that is imperative, unfortunately, in our field. Before we learn more about their cancer in order to get them the what we call right treatment, because every single patient is different. Even if you have the same mutation, your disease burden is different, your symptoms are different, the whole journey that you're going to go through is different, and just find your rock.
All right, I completely agree with both what Terry and Dr. Khalil mentioned. I think it's super important to focus on who is your support network? Can I continue to try to maintain the same routine that that existed pre-diagnosis, whether that be trying to eat breakfast at the same time, go to work, because I think that really can help tackle the waiting time. And one other piece of advice that I think is helpful, especially for those who do seek a second opinion, is trying to identify a spokesperson, either it be a family member or a friend, to help you stay organized in terms of your medical records. Because I would love that all the medical records talk to each other, but they don't always. And so I generally recommend people almost create their own, it's almost like a binder, like a CV, but for your lung cancer, and try to collect CDs of the actual pictures of the scans, try to get a copy of the scan reports, try to get a copy of the pathology reports, because those pieces of information are very important for other doctors when they're trying to better understand your type of lung cancer. And I think the other thing to do is for your first appointment, if possible, try to come up with a list of questions that you have, because I think that really keeps the appointment organized and maximizes your chances of getting your most pressing questions addressed by the doctor. So I usually really like it when my patients come with a list of questions. I can look at it quickly and say, like, here are my answers to these questions, or these questions will be addressed. And I think that makes seems like it makes the first few appointments the most productive when patients themselves are prepared and they come with a family member or spokesperson, because I think that everyone picks up a different aspect of those initial conversations, and then you can go home and regroup and share what you understood and regroup and come back with a second set of questions. And so I encourage all of my patients to do that.
Can I throw one more thing in that suggestion as well? The other thing I would say is give yourself, as the patient, a little bit of grace. Okay, and that's kind of appropriate here too. Give yourself some grace. It doesn't matter how you got it, what you got, you're going to do something about it right now. It's been there for a while. You've got 24, 48 hours. It's okay. Give yourself a little bit of space to breathe with that. And even if you don't get all the information, even if you're going to write down every single question and you're not going to exactly understand it the first time through, that's okay. Ask the doctor again next time. Don't think you're going to get all the answers in one and done, because it is a little bit of a moving target and they understand that.
That is very, very insightful, Terri. And I usually tell my patients, especially that first visit, you are really drinking from the fire hose. You are just getting information from all around, many different information about the diagnosis, the treatment options, all the other things. And it is something that we all realize on the healthcare side of things, that if somebody walks out of our clinic room and they have retained 10 to 20% of what we said, that's a win. And just, you can come back and you can ask questions. And if you have questions, you can just jot them down. And in that second visit, you can come back after you've kind of digested a lot of what was given to you, to come back with questions in more details, if you want, about things that you didn't ask the first time. So totally agree.
I think that you all beautifully and eloquently answered that question, and I had so many little mini takeaways. I think that, this is a very nice segue to, finding your comfort and finding your, getting back in the saddle and understanding your disease. But then all of a sudden you're up for your first scan, or you're up for your 50th scan, and you have that scanxiety, which is a common term that we hear.